My name is Joshua Kennell. I am a freshman biology major here at Bethel College.
And I am Harkins, and I am a sophomore biochem major here also at Bethel College.
And our faculty advisor for this study was Dwight Crable. Our study is, this is the COVID-19 protective behaviors and beliefs at Bethel College. Our study was investigating protective behaviors against COVID-19, against the virus, as well as beliefs about the virus and correlations between those and positive tests, as well as the role at Bethel of students versus staff and faculty.
So as many of you know, COVID-19 was declared a pandemic by the World Health Organization in March of 2020. And Bethel College's response to that originally was for students not to return to campus after their spring break last year. And they reopened campus again for classes this August. And so we surveyed participants on several things relating to COVID, including mask behavior, beliefs on protective behaviors, and then whether or not they had positive or negative tests. And then to code and analyze this data, we used our software. So some research questions or hypotheses that we had before performing the study included: have students tested positive for COVID-19 more times than staff and faculty? Do students tend to wear their masks less often or incorrectly? Are students more skeptical about the virus? Does skepticism about the virus lead to an increase of positive cases? Does the way that people wear their masks or how often they wear them affect their chances of catching COVID-19? Does the number of COVID-19 cases increase with perceived risk? Do strong beliefs about the effectiveness of protective behaviors result in a decrease of positive cases? And finally, does a higher score of self-reported knowledge lead to a decrease in positive cases? And we will explain what we found on these later on in our presentation.
The way we went about doing this is that we used a Google Forms to distribute this survey through the Bethel email system to all students, faculty, and staff. As we were creating this form and coming up with the questions, we found a very similar questionnaire that was created by Johns Hopkins University's Bloomberg School of Public Health and Vital Strategies. And we took a lot of inspiration from that specific questionnaire. We got 160 responses, plus one that we dropped because they did not answer any questions, and quite a few more male than female responses, as well as slightly more students than faculty. And the survey was open in the beginning part of December. That is significant because the pandemic has kind of gone in waves, and it certainly changed very quickly. And that time period was kind of right before the huge holiday spike going into January. So there were certainly quite a few cases at that time. So once we had our data, we had to analyze it. And one way that we went about doing this is that we created composite variables: effectiveness, mask behavior, skepticism, and exposure. And we did that by taking individual questions, multiple questions that related to this one variable, and summing up those scores that participants got on those related to that. And we will have those questions later. Another important thing to note is that we used a p-value to indicate whether or not the results were significant. Below 0.05 is considered significant. Another thing to note is that because our data tended to have a lot of outliers and pretty skewed distributions, we ended up using a Wilcoxon rank sum test, so we have the W statistic included in our presentation.
So our main goal, as we stated earlier, was to kind of compare the positive COVID tests to negative COVID tests of students and basically non-students on campus. And that non-student group includes staff, faculty, admin, and coaches here at Bethel College. And as you can see, we have the numbers here of people who participated in the survey, and we converted those to percentages so you can see the comparison a little better. But we did have quite a bit more students who had a positive COVID test result. And another thing I just want to point out is that these test results were self-reported in the survey. We didn't get these from the school or any other resource. It was just from the surveyors themselves. So knowledge was one variable that we asked about on our survey, and it included the question, how would you rate your knowledge level on how to prevent the spread of COVID-19? And so we gave them a scale to answer this of very good knowledge, or poor knowledge. And we did exclude one case, as we mentioned before, because they're the only person that listed poor knowledge. And then below here, we have a table showing the relationship between good knowledge and very good knowledge to positive and negative tests. And so you can see here, with people that had very good knowledge, they had more negative tests for COVID. So you can see that correlation, that a higher knowledge of how to protect yourself led to less positive cases. And then we again compared this to the role of people on campus. So it shows that students reported, or non-students reported, having a higher knowledge level on this. And so, as we mentioned before, they also had less positive tests. So you can see that relationship there as well.
Masks are a very effective way to prevent the spread of COVID, as we see in these studies here, especially with mask mandates from counties. Cases tend to decline with mask mandates as they increase without. And mask wearing has also been heavily politicized, especially at the beginning of the pandemic. I think we all remember that time period very well. And so for our survey, we used the survey question, how often did you wear a mask in the following places during the first semester, with a list of different places that you would or would not wear a mask. And our scale ranged from never to always with that. As we see with mask behavior versus positive tests, when the mask score, wearing score goes up, meaning that people wear their masks more often in the different places, the odds that you will have a positive test go down, as you see with the no positive test there, versus people that had a lower mask behavior score here. They had a tendency to have a positive test, if you note the significant p-value there. And if we look at role, staff and faculty tended to have a higher mask score, meaning that they wore their masks more often compared to the students, and that value is rather significant.
Exposure was another variable that we surveyed over, and this is something that we wanted to ask about because we assumed that with increased exposure, there was an increased likelihood of catching the virus. And so we asked the participants to judge their own exposure, and we did that by asking this kind of overall question here, that they please estimate their exposure to people who tested positive for COVID-19 within 2 days before or after their contact with them, and then to estimate how many times. And so they kind of gave us a number for each of these scenarios here, where they're within 6 feet of them for 15 minutes or longer, if they provided care to them, if they had physical contact with them, shared eating or drinking utensils, or if they somehow got respiratory droplets on them. And then in the graph here, we compare the positive test to their exposure score. So we summed up those values there. And you can see that with a higher exposure score, they were more likely to test positive, which is what we were looking for. And then exposure in comparison to the role at Bethel, you can see that the non-students had a much lower exposure score. And as we again mentioned before, they tested negative more than students. And so we kind of see that relationship there. And these two graphs did have a fairly low p-value, so it showed quite a bit of significance there.
As I mentioned before, COVID-19 has been pretty heavily politicized, and there's been a lot of skepticism surrounding preventative strategies and just kind of the virus in general. It's also important to note that human beliefs and decision making is very complicated. So just because maybe we know something or the science says that something is a certain way, we don't always our beliefs don't always match the level of risk that's really there. It's also another thing that we wanted to mention was that Bethel College has done a good job of encouraging prevention strategies with hand sanitizer at every entrance, mask wearing everywhere, even outdoors on campus, and desks that essentially force us to social distance in classes, and that helps prevent maybe different beliefs affecting things. And we were wondering if a higher score of skepticism would maybe increase your chances of getting a positive test. And so we used these questions related to skepticism to see whether or not people strongly disagreed, to strongly agreed with these questions. And it's important to note that 3 out of the 4 of our skepticism questions relate to mask wearing. Masks have been proven to be effective, and they were so heavily politicized that it's kind of a good indicator of skepticism here. Here we have our graph of skepticism versus positive tests. It is important to notice that this graph is not significant. We did not find significant findings. The graph does it is skewed more that those who had a positive test were slightly more skeptical, but once again, that is not a significant value there. Now with skepticism versus role, we did have significant findings there that students were more skeptical in general than staff.
And so we did have a couple factors that we found were not predictive of positive tests, and those included the question that we had asked for participants to judge their perceived risk, and then we also had created a combined variable, including questions about judging their beliefs on the effectiveness of COVID-19 protective strategies, and we did not see any prediction there. The p-value didn't show significance. And so back to our research questions, you can see here most of them were proven to be correct or accurate to what we had originally thought that they would be. And then this last one here, as I just stated before, they didn't show any predictiveness for the positive test results.
We have references. Thank you for listening to our presentation. We hope that you found it interesting, and please continue to wear masks and social distance and do all of those things as we continue to deal with the pandemic. And I'd also like to say a special word of thanks to Dwight Crable. He's been very, very helpful throughout this whole process.
Yes, thank you.
That's been a good thing. So thank you. Bye.